Newsfirst, face-to-face with Jamal Ratnayaka.
Very good evening and welcome to yet another edition of Face to Face, coming to you live and direct from our Newsfirst studios here in Colombo. Tonight my guest is a newcomer to the show. However, he is no stranger to political fora and news programs. My guest tonight is Dr. Nihal Abeysinghe, General Secretary of the Jatika Jana Balawegaya. A very good evening to you, Doctor, and welcome on the show.
Good evening, Jamal. Yes.
So, Doctor, I want to talk to you first about something that has come to the fore in Sri Lanka and something that has battered millions of Sri Lankans. Healthcare. Healthcare is an important aspect for any country, may it be a developing country or a developed country. And Sri Lanka, for many years, had one of the best healthcare and free healthcare systems in the region, for that matter. However, that credibility has been vanishing for some time, and I believe that it capitulated when it came to the crisis and the Aragalaya that followed. But you have been in the healthcare system here in Sri Lanka as well as internationally. You were the chief epidemiologist at the Ministry of Health. Thereon you went to serve the WHO in New Delhi. So you know the inner workings of the systems here in Sri Lanka and also the global perspective of how healthcare is taken care of. So, Doctor, to begin tonight's show, tell me what sort of fate has befallen the healthcare sector in Sri Lanka and how did we end up here?
Thank you, Jamal. Actually, Sri Lanka, we had one of the best health system in the world. I mean, if at all, because I have been working in many countries with many teams.
Yes.
And I mean, this up to 2000, really we had very good health system in the country, and you know that we have a large number of hospitals throughout the country. We have the teaching hospitals perhaps in each province,
yes,
in each province, and we have district at the district level, the provincial general hospitals,
yes,
and the district hospitals and the peripheral units. So it serves to all the Sri Lankans throughout the country. And also we have one of the best public health system in the world, and in fact some time back even up to 2010 the whole world was really taking examples from Sri Lanka for developing their public health services.
I see.
So I think since about from 2000 or 2010, it started deteriorating. Perhaps these are all related to the governance issues.
I see.
Actually, the system is there. We have a very good trained health staff, and we have the consultants, the medical officers, the public health inspectors, and the public health nursing sisters, the public health midwives. It's really a good staff that we do have, and a very well trained. So we have been having a very good, we are providing a very good service to the public. But during last 10-15 years, I think in general the corruption and the mismanagement came into the health system, even the health system. So it has been there in the other areas, and it really I think these two things, corruption and mismanagement, led to this pathetic situation today.
Right.
So that's really my assessment, and we don't have to do much really to bring this back to the track.
Okay.
We can within about few years we can bring this back, provided that we correct this the two issues, corruption and the mismanagement. And if we do that, certainly our health staff can bring back the glory that we had.
Right. So you have identified the root causes of Sri Lanka's healthcare sector's downfall. So let's talk solutions. Fraud, corruption and mismanagement are the three key reasons you pointed out that has led to the healthcare system to be in the state that it is today. But it is easy to point out the mistakes, Doctor. But what is difficult is to put things into action
Yes.
in order to get things cleaned up, to clean house and to make the health sector efficient. So in your expert opinion, drawing from your experience here at home and also globally, where should you start first in getting Sri Lanka's healthcare sector back to where it used to be?
Jamal, the first thing that perhaps that we need to do is really to strengthen our primary healthcare services. So once we do the primary healthcare, I mean, we could get back to the primary healthcare services that we had, and then if we develop the confidence of the public,
yes,
so then the people will start using these primary care units. Of course, we have to improve the facilities at the primary care level.
Yes.
We have to look into the issues faced by the health workers, the doctors, the nurses,
yes,
and the rest of the staff. So if we look at those at the very beginning, then we know that we can keep the crowd at the primary level for the immediate services, right? So then we can limit the people who are coming to the secondary level and the tertiary level. So by doing that, really that means the workload in the secondary and tertiary level we can cut down. So that is really the issue today, because we are getting a large number of patients coming bypassing the primary care units to the secondary and the tertiary level. So then the tertiary level and the secondary level staff, they get overloaded. The work get overloaded, and then what the government will do is, they have been doing, what they were doing is really they further strengthen the secondary and the tertiary level, neglecting the primary level. So first thing I would think that we have to start strengthening the primary care level, let the basic facilities we get back the basic facilities at the primary level, and then reduce the crowd coming to the secondary and tertiary level, and then support the all three levels, improving the current services.
Right. So in improving the healthcare sector, one vital matter is, let's say we do improve our primary level and the groundwork is laid, but we have been seeing a mass exodus of professionals, mainly health professionals, leaving the country following what we witnessed a couple of years ago, and they do not seem to be wanting to come back because they have finally made a decision to cross over to another country and to live their lives there. So against such a backdrop, how do you suppose we strengthen our healthcare system through human capital by retaining the best of the best health professionals that Sri Lanka has to offer, ensuring that they do not travel overseas seeking other opportunities and they remain within the healthcare sector, Doctor?
Jamal, any given time, there is about 800 to 1,000 postgraduate trainees in the system, right? So we continue to educate, we give the postgraduate education to the doctors. So that means we are producing certain number of specialists every year. Of course, there are people who really wants to go to the other countries, and then perhaps not only because of the economic reasons, right? It's not because of their salary is low, but it's uncertainty. Now, uncertainty created by this economic crisis, so they are worried about their children's future, their children's education. So if they find a chance to work outside, because most of these professionals like specialists, they have had their postgraduate training either in UK or Australia. So they know the environment, they have been working there, so they know, they have their friends, they have their the senior connections, so therefore that they can easily find the jobs, right? So that is the reason why they are leaving. Not only the salary issue, but they are now, everybody is uncertain about our future. So it's very difficult a father to say a child to not to go, because you can't guarantee a reasonable future for the children at this particular moment, right? Unless we change, so people will have to, make their choices.
Right. So let's talk about medical education in Sri Lanka. That is yet another contested topic, especially with the introduction of private medical colleges for about a decade or so, there have been many protests, a lot of opposition for private medical colleges being established in Sri Lanka. I want to just gauge the Jatika Janabala Vega's stance on this, because there are a lot of state university students who are opposing this, and a lot of factions that say that the quality of the education that is delivered to private medical colleges will hurt the Sri Lankan healthcare system when students from those medical colleges finally graduate and come into the system. And there are so many other attributes that they have pointed out so that they oppose such moves. I want to firstly gauge your personal opinion on this, and thereafter gauge the Jatika Janapala Vega's opinion, because should you come to power, this is something that must be addressed and must be solved in order for us to move forward.
Jamal, there is no difference between my opinion and the National People's Power opinion, because we are thinking of actually to give our children the best education system, I mean, as much as possible, right? So therefore, I mean, we know that there are parents who are really willing to give their children medical education.
Yes.
So there is a limit. When we have now 12 medical faculties in the country with the Uwavelassa one, right? So therefore, a reasonable number will be produced, medical doctors will be produced during the next couple of years.
Yes.
So if you really look at the need for the country's health provision of the health services, we need to really look at how many medical doctors that we need for the services, how many we will be for giving the postgraduate education. So we have to have a plan. Once we have a plan, then we know that how many medical graduates that we need to produce. So then now for the moment, if you look at the current the government medical faculties, there are not enough facilities, and you can see that every day students are protesting because they don't have facilities for clinical practice, they don't have the professorial units, at least in Ratnapura and Uwavelassa. So there are so many problems in the government medical faculties at the moment. So our stance is, first we need to correct this, right? We need to provide these medical faculties. Already we have. They have to have a reasonable, facilities for students to have their, to do their studies. So then, there is of course, if we need little more than what we produce, then there is an opportunity that, if possible, we are really willing to do that. We will have few more medical faculties because we believe that medical education and whether it is medical or any other education is a responsibility of the government, because it's all our children, right? So we have to provide that service for the children. So therefore, if we can expand a little bit, we will expand the medical faculties in the country. Whether if we can expand after improving the services providing now, right? If we can satisfy with that, certainly that will be the solution for this. But there can be children who wants to go abroad and have medical education in the other countries. We have no objection for that, but we have to look into the foreign the income that we need to foreign exchange for that purpose. So if we do have adequate foreign exchange, it's okay in the future, even in the future, to do that. But for the moment, we think that it has to be a government responsibility, and then government should try to improve the services and expand the services and let the children come and get the education and then get into the system. So get into the system. So far, every medical graduate have been absorbed to the current system in the health system, right? So that in the future, we need to think about that also, because whether we need to absorb or whether we can absorb, so all has to be in a one plan.
Right.
Once we have that plan, certainly we can think of whether we really need any further private medical education. If that the need is there, certainly the opportunity should be there.
Right. So talking about education when it comes to university level, there are a lot of private universities even providing medical education and also in other streams, doctor. And it is because of the fierce competition to get into state universities that many parents opt to send their children into those private universities. The ones who are able to afford to send their children abroad to study in those universities, physically they do, but for the most part they go to affiliated institutions that are run or that provide education through overseas universities. So should the Jatika Janapalvega, the National People's Power, take the helm of the country, what sort of a decision will you make on state universities? Will you broaden the level of or the number of students that are absorbed into state universities? Will you allow private universities to continue but with more oversight on them? How will that work?
So anyway, I mean, our main aim will be broaden the opportunities in the
State sector. Right.
But so far we do have, I mean, for the moment we do have some private universities and private institutions. So we need that these private institutions to give the best available services to the children who are enrolled.
Who
right?
opt to,
so therefore that, I mean, we perhaps might need a little bit of monitoring of what's going on in these institutions, and we can discuss with the teachers, we can discuss with the parents and the students. Perhaps that part of monitoring we will have a system of monitoring these private universities. But our main aim will be that broaden the government sector and provide more opportunities for the children to get in. In fact, if you read our education policy, there is we have indicated that the children who will get into the year 1, I mean after 13 years of their education, at least 50% of those children who get into the year 1 should go for the tertiary education or university education. So that's our target. Right, so but it will take some time to get into that level, but still that is our objective.
Right. So we spoke about healthcare, we spoke about education. Let's come into the matter of politics. And while there are so many other issues in Sri Lanka, the political landscape has been set alight by the burning question, the million-dollar question: what election will be held, presidential or general? We know if the presidential election rolls over first this year, Anrukumara Disanayake will lead the National People's Power as its presidential candidate. But should the general election be announced, Dr. Abeysinghe, something that I've heard from certain skeptics who are still unsure of whether to support your movement is that there aren't many figures in the National People's Power who could make it into parliament. We know of the Anrukumara Disanayakas, the Harini Amarasuryas, the Vijita Herats, the Nihal Abeysinghes. But should a general election be called, are you confident that the National People's Power could secure a majority in parliament?
Jamal, I mean, we are confident because we have been working for last 6 years with the people of this country, and we initiated this work with the National Intellectuals Organization, and we formed that. We brought in intellectuals into politics, and then we developed the national policies for this country, and so we came very systematically reaching the public, right? So initially we created our executive body, and then we went to the district level, and then we went to the Grama Niladhari level. So we do our politics, I mean, at all levels now. It's true that we don't have identified figures, right, in our cadre. But we do have very good professionals who have been working in the system, who know the subjects, various subjects, and who can who have really worked in the ministries, who have experience. So we believe that, I mean, these professionals who have joined the National People's Power, so they will take part in the upcoming elections, whatever if it is the parliamentary elections. There will be many graduates who have a lot of experience in various disciplines will be contesting in the parliamentary election. So we trust, because they have been they have been working at different levels.
Okay.
So they are familiar with the system, and they have a lot of support at the ground level. Okay. Right. So though we don't have that is the political figures much with our party, I am sure that people will trust on, and they know that we are honest. They know that why we have opted for politics, because we have been professionals in various disciplines, but for last 6 years we have brought many professionals into politics.
Right.
So those are the people, those would be the people who will be contesting in the upcoming parliamentary election. Right. So we believe, I think we will trust people who they will trust us. So that's how we are looking at it.
I see. So what led me to ask you that question, Doctor, was in 2019, the SLPP's headline for bringing about Gotabaya Rajapaksa was introducing someone who has not been in politics, because the people believed, or the popular sentiment was, that politicians were corrupt and they needed someone who was out of politics, who wasn't in politics before, to come in and clean house. But now the Jatika Jana Balawega, or the National People's Power, is once again requesting the people to trust a group who have not been in parliament or any sort of politics before to take the helm and to run the country, take Sri Lanka to the next level. So what sort of a plan, or what sort of vision do you have to instill confidence and assure the people that the mistake that was made in 2019 by the same voters will not be repeated this time around?
Jamal, we do have a really reasonable plan. Actually, now Andu Kumar Disanayake has been telling, we will have 25 ministers and 25 the deputy ministers.
Right.
That's all that we are going to have. We do want to reduce the numbers, but for the moment, we think that we have to use these available the professionals with us. Certainly. To make use. To come up from this crisis that we are having. So, and then each ministry, not like how these other politicians ran the ministries, we will have a group of advisors to run the ministries, because we do have adequate number of professionals working in different areas.
Okay.
So whoever becomes the minister, whoever becomes the deputy minister, they will be supported by a group of professionals who know the subject, right? So that's our plan, and I am sure that very soon public will realize when they see our the program. I mean, when we are coming for the election, we will have our program, the program of work to people to go through, and I am sure that they will realize that we are planning for a changing this particular the present system that we have. So therefore, that we think that people need a change, and people have been looking for a change since 2015.
Right.
And this is the opportunity, and if we can convince the people, I'm sure that within next couple of months that we will try our best, and starting from the May Day, that we will be having the May Day in 4 places in the country.
Right.
In the morning it will be in Jaffna, and the evening meetings will be in Anuradhapura, Colombo and Tangol.
Right.
So we will bring bring the crowd, and then we will assure them that the second half of this year we will go to the grassroots level, and we will be really organizing the public to develop the confidence. Yes,
right.
Yeah.
Very quickly, I want to continue talking to you about all of these matters, but since we're pressed for time, I must ask you what sort of plan the National People's Power wishes to execute when it comes to matters regarding the International Monetary Fund. Should you come to power, you should liaise and coordinate with the International Monetary Fund, because we are in an extended fund facility program with the IMF. So very quickly tell me what sort of plan, how do you plan to go about engaging with the IMF?
Jamal, now the present government has had already an agreement with the IMF. So we have now met IMF as a party, National People's Power, twice. So they know what our plans are, and we really will have a sound plan before getting to the discussions with IMF, and we will suggest some changes to the present agreements, and with a plan, with a proper plan. And I believe the National People's Power should be able to negotiate with the IMF and change its present agreement, and make a better plan for the future and for the benefit of the public. So we believe it.
You mentioned, Doctor, that you will suggest certain changes to the current plan. Would you mind sharing some of those with me and the viewers?
See, at the moment, Jamal, this particular agreement, we see that this government really not much looking at to ease the public the cost of living aspects. So that really we have to take
review,
because the people are suffering. So we have to make people the lives easy. So we will do, at least we will take up the issues towards that, and then really look at where we can really compensate it from the other areas, and perhaps that we will propose some plans. So of course we need a good plan to go for that discussion. So we will be preparing it in the next couple of months, and then getting ready for that.
Right. So my guest tonight on Face to Face, first Dr. Nihal Abeysinghe, General Secretary of the National People's Power. He comes with a wealth of knowledge, especially in the health sector. Thank you very much, Doctor, for joining me this evening and sharing your insights with me and our viewers, of course, and also the National People's Power's vision should it come to power in Sri Lanka, and what it hopes to achieve in order to take Sri Lanka back to where it was and restore Sri Lanka to its former glory. Thank you very much once again for joining me this evening.
Thank you, Jamal. Thank you for the opportunity.
And that's the way it was on Face to Face this evening. Thank you very much for joining us this evening. Take care and have yourselves a great night.